I know people are planning, probably already have set their appointments to see their doctors during the season of colds and infections. They want to know, should I vaccinate or not? My name is Dr. Mkono, and I think we should break it down just a little bit, and maybe you can come up with a conclusion on your own at home and then cross-check with your doctor. But this is how we run through it. Number one, yes, I have to get vaccinated because I'm required to do that with the institutions that I work with. They're already writing those little reminder emails, vaccinate, show us that you did, and if you didn't, tell us why. So it goes for us too. Believe it or not, we vaccinate to protect you. And I'm not saying I'm for or against vaccines. I'm actually saying to you that it really depends on you and what you're doing. And we're gonna run through that right now. And I need you to understand I'm not giving you medical advice. I'm just running through the process that I usually run through with my patients step by step. No, you should not call the office and leave a message for the doctor to answer this question. We will get thousands of calls, and you can imagine we also have other things to do, correct? So we're gonna run through this, and then you're gonna maybe default to following the CDC guidelines if you do not wanna go through this with me. But this is a cheat sheet, a little map that I would give you and tell you, consider these questions as you decide, because ultimately you're the one who's gonna go and get that vaccine. So you can say, did I ever get very sick, near death, because of an infection, such as flu or RSV? And if the answer is no, then maybe you can say, well, maybe I'm not convinced yet, right? I would have said COVID as well, but you can add that in the fill in the gap section. If your lungs now can afford to get sick, can afford meaning you can afford to be sick, you can afford to miss school days at work, days as a mommy or as a daddy or as a caregiver. If you can afford to do that, then maybe it's not a big deal if you don't get vaccinated, correct? But we just went through the first one, which is, do you have risk factors? Are you with pre-existing lung disease? And may I also include if you're immunocompromised, meaning your immunity is not to par, right? That will include HIV, cancer, on cancer treatment, still being evaluated for cancer, your immunity may be low, also pregnant, all these things. And I'm not trying to be your obstetrician, of course not. I'm just saying these are the things that you would be running through. And if the answer is, okay, I'm at risk because my immunity is low, you really should highly consider that vaccine as well, depending on which one they're offering. We are mainly discussing lung-related vaccines here, flu, RSV, right? So those are the ones I will be considering here, but you can go through this with your doctors regarding all the other vaccines out there, correct? And now, once we figured out those questions, we're gonna say, hey, you know, I got vaccinated before and I have allergies, and maybe you have egg allergies, etc. We will exclude those vaccines that will give you a problem with that. We need to go through that because it's not all vaccines, okay? You've had a very deathly response to a vaccine in the past, so maybe you're gonna have to reconsider that. You have an immunity problem that is negating you getting a vaccine, you will consider that. Now, don't self-diagnose yourself, because what's the alternative? I love to tell my patients that those viruses are not just appearing in your body. They're getting in somewhere, usually in the mouth and the nose, right? Our little kiddos usually bring it home in a package with a bow on it. So you already know that you need to watch out for your kids, the grandkids, and everybody who has jobs that require you to be around kids and grandkids and etc. The youth as well, because when they get sick, usually they bring it home and everybody gets sick. And of course, we blame that patient that we see, and we blame everybody else at the grocery store. But at the end of the day, it is really your risk we're calculating here. And you need to sit down with your doctor and consider it. At the end, if my patients feel, okay, you know, I have pre-existing disease, but I don't want to vaccinate. I've had an allergic reaction in the past that was caused me to be deathly ill, so I can never, ever consider it ever in my life. You know, those comments, those concerns, those hesitations, then you know what I tell them? I said, you know what? Then you need to be seriously covering up. Wear a mask. Plan to wear a mask for the season. It's not 100%, but I believe it is way better than the vaccines personally. If you're really going to live behind your mask for the whole season, even at that Christmas party or the New Year party or whatever party you celebrate this year, which by the way, happy holiday season in advance, which comes with a lot of infections, then I want you to know that those are the options you have. Well, what happens when you do get sick? Guess who is super happy that you got sick? Well, you know, pulmonologists are, because we actually gain from that. How about the pharmacies? Yes, they do. The urgent care, they are flooded with you guys. How about the hospital? Absolutely, yes. We actually hire people during season just to get ready, making the beds ready for you guys to come in. So you have to be smarter than yourself and probably the system, because I want to let you know that if you have lungs that have pre-existing lung disease, asthma, COPD, interstitial lung disease, sarcoid, I don't want to name all of them here, or if you have diabetes, you have frailness, age that is, you know, also a problem, you know, because the age, the higher you are in the age scale, I'm one of them, the more likely you're going to get sick, correct? So we're all in that. We need to figure out our risks. If any of those were yours, and if you add up 2 or 3, you should really consider maybe the flu, maybe the RSV vaccine, and maybe the pneumonia vaccine, okay? We are talking all infections, okay? We are all talking about vaccines, and I am talking to you. I am asking you to save this and share it with whoever needs to hear this, because there is no special calculation. We don't just look at you and we have a CAT scan with vaccines in mind and we know exactly what you're gonna get. No, and we have to really risk stratify you as to which category you belong in. And if you find yourself in multiple categories, you really need to consider strongly getting vaccinated. Not what Dr. Mkono says, but because Dr. Mkono won't be paying those bills for you, correct? And the hospital will definitely love to see you. We're getting ready to see you, and I wish you all the best if you don't see us this season. Take care. It's Dr. Mkono.